This multivitamin tablet, West-Vite with folic acid 0.8 mg, is a combination of B vitamins that are essential for treating or preventing vitamin deficiency. These vitamins are crucial for maintaining good health and are particularly important for individuals with poor dietary habits, certain health conditions, alcoholism, or during pregnancy. The B vitamins in this tablet include thiamine, riboflavin, niacin/niacinamide, vitamin B6, vitamin B12, folic acid, and pantothenic acid. Some brands may also include additional ingredients such as vitamin C, vitamin E, biotin, or zinc. It is recommended to consult with a healthcare professional if you have any questions about the specific ingredients in your multivitamin. The daily dosage and optimal timing for taking this tablet may vary depending on individual needs, so it's important to follow the instructions provided by your healthcare provider. When taking West-Vite with folic acid 0.8 mg tablet multivitamins, it is typically recommended to take it by mouth once daily, or as directed by your healthcare professional. Make sure to follow all the instructions on the product packaging. If you are taking a version that includes vitamin C, take it with a full glass of water unless directed otherwise. If you are using chewable tablets, be sure to chew them thoroughly before swallowing. For extended release capsules, swallow them whole and do not crush or chew them to avoid any potential side effects. If you are using a liquid form, make sure to measure the dose carefully with a medication measuring device, and do not use a household spoon. Some liquid products may need to be shaken before each dose, and products containing vitamin B12 may need to be held under the tongue before swallowing. Follow the label directions carefully for the most benefit. To get the most benefit from this medication, it is important to take it regularly at the same time each day. If you experience mild upset stomach or flushing, don't worry, it's usually temporary and may go away as your body gets used to the product. However, if these effects persist or worsen, it's important to notify your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the risks of potential side effects. Most people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek immediate medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of potential side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. As for the best time to take this medication, it's generally recommended to follow your doctor's instructions. The daily dosage and optimal timing will vary based on your individual needs and medical history. Before taking West-Vite with folic acid 0.8 mg tablet multivitamins, make sure to inform your doctor or pharmacist about any allergies you may have to its ingredients or any other allergies you have. This product may contain inactive ingredients that could cause allergic reactions or other issues. If you have diabetes, liver problems, or a vitamin B12 deficiency, pernicious anemia, it's important to consult your doctor or pharmacist before using this product. Chewable tablets or liquid products may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, or phenylalanine, be sure to consult your doctor or pharmacist before using this medication. Liquid forms of this product may contain sugar and/or alcohol, so if you have diabetes, alcohol dependence, or liver disease, it's important to ask your doctor or pharmacist about using this product safely. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to consult your doctor before using this medication. This product is safe to take during pregnancy when used as directed, and maintaining adequate amounts of folic acid during pregnancy may prevent certain spinal cord birth defects. Consult your doctor or pharmacist for more details. This product passes into breast milk, so while there have been no reports of harm to nursing infants, it's important to consult your doctor before breastfeeding. When taking West-Vite with folic acid 0.8 mg tablet multivitamins, it's important to be aware of potential drug interactions. Some medications and supplements may affect how this multivitamin works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Before making any changes to your medication regimen, consult with your doctor for approval. Certain products that may interact with West-Vite with folic acid 0.8 mg tablet multivitamins include altretamine, cisplatin, certain antibiotics, such as chloramphenicol, certain anti-seizure drugs, such as phenytoin, levodopa, and other vitamin/nutritional supplements. It's also important to note that this product may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are using this product. As always, consult with your healthcare provider for personalized guidance on medication interactions and lab test interference. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, it's important to call 911 immediately. For less severe symptoms, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Make sure to attend all your medical and lab appointments as directed by your healthcare provider. It's important to note that this product should not be used as a replacement for a balanced diet. It's best to get your vitamins from healthy foods, such as leafy greens, vegetables, meat, fish, poultry, and enriched breads and cereals. These foods naturally contain B vitamins. If you usually take this product regularly and happen to miss a dose, just take it as soon as you remember. But if it's almost time for your next dose, then it's okay to skip the missed one. Just continue with your next dose as scheduled. And don't take a double dose to make up for the missed one. Make sure to check the storage information on the package, and if you have any questions, you can ask your pharmacist. It's important to keep all medications out of reach of children and pets. When you no longer need this product or it is expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.